Hello everyone, welcome back to our channel CPC Edda. Today we are going to discuss about three modifiers, modifier 54, 55 and 56. Okay, so these are the topics we are going to discuss today. Modifier 54, modifier 55 and modifier 56. Modifier 54 is surgery only. Modifier 55, post-operative care only. Modifier 56, pre-operative care only. See, all these modifiers belongs to surgery. Okay, so now we'll start with modifier 54. Modifier 54 is used to indicate that the surgical care was managed by the surgeon, but the patient's post-operative care was transferred to another provider. Okay, it means surgeon only performed surgery alone, and pre-operative care taken by some other provider, and post-operative care taken care by some other provider. Okay, so whenever surgeon did only surgery and he did not managed post-operative care or pre-operative care, that time we should use modifier 54. Okay, so when we need to use modifier 54 is the surgeon performs the surgical procedure and manages the patient's care during the post-operative period until care is transferred to another provider. The decision to transfer care should be made during the surgery or immediately after based on the patient's condition and care needs. And examples. First example, a patient undergoes a laparoscopic cholecystectomy performed by a surgeon. The surgeon manages the immediate post-operative care in the surgery room and transfers ongoing care to the patient's primary care physician. So in this case, laparoscopic cholecystectomy performed by a surgeon and care transferred to primary care physician. Okay, post-operative care taken care by primary care physician. So surgery only did surgical care only. So we have to use modifier 54 when billing for the surgeon. And another example, following a cardiac procedure, the surgeon monitors the patient's condition in the ICU and transfers care to the cardiologist for further management. So modifier 54 is used to indicate the transfer of care. Okay, here surgeon performed the cardiac procedure and transfers the care to the cardiologist. So next, modifier 55. Modifier 55 is appended to a procedure code to signify that the post-operative care was provided by a different provider than the one who performed the surgery. This modifier helps ensures that each provider is appropriately reimbursed for the care they delivered. Okay, it means provider taken care the post-operative care only. Surgeon did the surgery and he left. Post-operative care taken by some other provider. When billing to that particular provider, we have to use modifier 55 with this procedure because that particular provider taken care by only taken care post-operative care only. Okay, so when we can use modifier 55, post-operative care is transferred from the surgeon to another provider. The new provider takes over care during the global period of the surgery. So documentation requirements for modifier 55. Proper documentation should include details of surgical procedure performed, what procedure they have performed, that detail should be there, and date when the post-operative care was transferred. The transferred care when it was done, that date also should mention. The name and details of the provider taking over the post-operative care. Who is going to taking care of the post-operative care, that particular provider's name and detail should mention. So examples. 1. A patient undergoes a hip replacement surgery performed by an orthopedic surgeon. Orthopedic surgeon performed hip replacement surgery. After the initial recovery, the patient's primary care physician takes over the post-operative care. Okay, patient's primary care physician takes over the post-operative period. So modifier 55 is appended to the post-operative care codes. Okay, when billing to primary care physician, that post-operative care taken care by him, right? So we have to use modifier 55. Another example, following a cesarean section, the surgeon manages the immediate post-operative period. The patient is then transferred to a maternal fetal medicine specialist for ongoing post-operative care. So while billing for the specialist, we have to use modifier 55. Okay, for what the services provided by the specialists. Okay. So now we'll go to another modifier 56. Modifier 56 is pre-operative care, right? Who taken care the pre-operative care alone. For that particular provider we can use modifier 56. Pre-operative care, let's see. Modifier 56 is appended to a procedure code to signify that the operative care was provided by a different provider than the one who performed the surgery. Surgery some other provider surgeon doing, and pre-operative care taken care by another physician. This modifier helps ensure that each provider is appropriately reimbursed for the care they delivered. Usage criteria: pre-operative care is provided by a different provider than the one performing the surgery. The pre-operative care includes the evaluation and management services before the surgery. Okay, before the surgery, if some other provider performed evaluation management services, or they will examine, right, for this procedure he is eligible or not, now his condition is okay or not, like that they will check the patient condition before going to the surgery. All vitals are correct or not, everything they will check. So that and all comes under pre-operative care. So when someone performed these things, will assign 56 modifier to him. Okay. So example 1. Patient is scheduled for a knee replacement surgery by an orthopedic surgeon. The patient's primary care physician handles the pre-operative care, including medical clearance and pre-surgery instructions. So modifier 56 is appended to the pre-operative care services. So here, patient scheduled for a knee replacement surgery, that will be done by orthopedic surgeon, but patient's primary care physician handles the pre-operative care, that includes medical clearance and pre-surgery instructions. So while billing to the primary care physician, we have to use 56 modifier because he did the pre-operative care. Another example, a gynecologist plans a hysterectomy for a patient. Another specialist provides the pre-operative evaluation and management. So modifier 56 used for the pre-operative services provided by the specialist. Okay. So now we'll see documentation requirements for modifier 56. Details of the surgical procedure planned. Those details should mention the date and details of the pre-operative care provider. The name and details of the provider should be given in the documentation. Okay. So that's it for today. Thank you so much for watching. So today we discussed about modifier 54, 55 and 56. Modifier 54 is surgical care only. When provider performs only surgery and he is not taking care pre-operative or post-operative, he did only surgery, then we'll assign modifier 54. And modifier 55 is for post-operative services. When a particular provider gives only post-operative services, we have to utilize modifier 55 for that particular provider. And modifier 56 is pre-operative services. So when particular provider gives only pre-operative services, we can utilize modifier 56 for that provider. Okay. And once again, thank you, and don't forget to subscribe our channel CPC Adda. Bye bye.